Hi, I'm Emily Mowland, and I am the ADHD pathway lead at Basingstoke CAMS. I'm going to talk to you about girls and ADHD. Internalisation, not always externalisation. NICE guidelines highlight that ADHD is under-recognised in girls and women. They are less likely to be referred for assessment, may be more likely to have undiagnosed ADHD, and be more likely to receive a diagnosis of a mental health or other neurodevelopmental condition than they are ADHD. Prevalence of ADHD across the sexes varies around the world. In the UK, the male to female ratio is approximately 3:1. Females are also more likely to be diagnosed later than their male counterparts and have reduced access to medication to help support them, despite the overwhelming evidence of the wider impact of ADHD. Owing to reduced identification of ADHD in females, it doesn't come as much of a surprise that the diagnostic criteria was devised heavily weighted towards a male presentation. Men and boys with ADHD are more likely to display behaviours such as hyperactivity, disruptive behaviour, frequently losing items, interrupting others during conversations, aggressive and defensive behaviours, high-risk behaviours, for example, substance misuse, speeding, unhealthy sexual behaviours, excessive financial spending, angry outbursts, and insensitivity. These behaviours are externalised, they are visible, and owing to the disruption they cause, they are more likely to be identified earlier. The female presentation of ADHD can be far more complex and at times be very, very subtle. Females have the same core symptoms of inattention, hyperactivity, and or impulsivity. However, these symptoms can be expressed differently, which is why it's usually detected in late adolescence or in adulthood. Gender norms and social expectations also have a role to play. For example, symptoms of inattentiveness can often be dismissed as daydreaming, and interrupting others can be labelled as chattiness. Some evidence highlights that females are more likely to present as inattentive, and these are symptoms such as losing focus, daydreaming, being disorganised, forgetful and often late, difficulty maintaining attention and switching off whilst others are talking. However, females frequently report internalising symptoms of hyperactivity, such as excessive talking. They report to be internally restless, needing to fidget, often needing to get up and walk around, acting impulsively by buying things on the spur of the moment, or speaking before thinking, daydreaming because thoughts are tornadoing around their mind and they struggle to keep their brain focused on a single topic. They might be able to make friends easily, but these can be transient as they really struggle to maintain them. They may engage in self-harming activities or activities that require extreme and unhealthy self-discipline. They can also adopt compensatory strategies, such as things that lead them to working 2 to 3 times harder than their peers to be equally as successful. For example, chronic disorganisation can be masked by perfectionism. They may fear rejection by peers and perceive comments as negative, and that they're just not good enough. Overthinking and people-pleasing to avoid criticism. Difficulty saying no and setting boundaries. Fatigue and or burnout from masking traits and just pushing through them. Females tend to present with more internalising symptoms such as despair, inadequacy, and overwhelm, which cause a lack of motivation and impatience. They can experience significant emotional dysregulation, where they cry with deep emotion, experience anger that is over and above what would be expected, carry feelings of guilt and shame, and have episodes of rage, or tears. Mental health conditions such as depression, anxiety, and OCD are more noticeable than ADHD and are often treated first. Females may be more susceptible to low self-esteem. They're also more prone to body-focused repetitive behaviours such as skin picking, hair pulling, leg bouncing, nail biting or cuticle picking. Varying hormone levels can also exacerbate ADHD symptoms. Females can experience intense premenstrual symptoms, and symptoms of ADHD can naturally intensify throughout menopause. These symptoms can be frustrating and exhausting, especially when they go unrecognised or are dismissed as anxiety, stress, just being disorganised. But their impact is really significant. Some females with ADHD appear to function well on the outside, but behind the scenes, it can feel like a constant battle to keep up. They are like swans gliding on water, and their legs flapping. Signs of high-functioning ADHD in women might include a mind that never switches off, constantly feeling overstimulated or exhausted, jumping between tasks but rarely finishing them, difficulty prioritising or managing their time. They tend to overcommit. They forget appointments, names, or even tasks. They struggle to relax or enjoy any downtime without that feeling of guilt. They also have strong emotional reactions that feel really hard to regulate. So after all of that, it may come as no surprise that when females present with a more typically visible or externalised male profile in terms of difficulties with hyperactivity, impulsivity and conduct problems, it's a strong predictor for clinical diagnosis. Thank you so much for listening. I hope this has been useful. There's so much research and evidence out there at the moment about the female presentation of ADHD, and I hope that this has been helpful for you. If you need any further advice or support, please don't hesitate to have a look at our CARES website.